Hospitals rely on scannable patient identification wristbands to ensure patients are identified and receive the correct surgical procedures and medications. However, in some procedures, such as spinal surgeries, patients' wrists are inaccessible as they are pinned below their bodies, requiring nurses to cut off the wristbands in order for the information to be accessed during the procedure. This poses a major risk. If patient wristbands are removed and lost, patients can receive the wrong procedure or medication, which can be lethal. From 2003 to 2005, there were over 200 incidents and near misses related to missing wristbands reported in the UK.
To address this, our client, Duke Hospital, has tasked us with designing a solution that allows patient wristbands to be accessible during all surgeries, while also ensuring that the wristband remains with the patient. For 2 months, our team developed a design solution to this problem in coordination with Team Hospital Tags A that completely addresses the client's needs.
Our final solution is a retractable device tethered to the patient that securely holds the patient wristband during surgery. It can be extended and shortened to any length and includes a mountable holster, allowing for a convenient placement and usage during surgery.
Our product has 4 key design blocks: the retractable spool, the sealable pocket, the temporary attachment to the patient, and a holder. The retractable spool allows the patient identification information to extend away from the patient, making it more easily accessible. Inside the 3D printed exterior case, there is a 3D printed spool that holds 7 feet of fishing line. We used fishing line because of its small size and strength. However, in a production model, we would use thicker, more visible cord. When the string is pulled, the string can extend up to 7 feet and then retract back thanks to a clock spring inside the spool. The spool also incorporates a ratchet mechanism that locks the spool to whatever length it is extended to. It can be easily retracted by pushing this button back, allowing the spool to rotate freely. This allows for easy and quick adjustment.
The sealable pocket is attached to the spool with a keyring and holds the patient wristband during surgery. It uses a 3D printed case for durability with a clear sealable pocket inside. The patient wristband is folded and placed inside the pocket, which is clear on both sides, allowing for all patient information to be read or scanned while inside. The pouch is sealable so that the patient wristband can remain secure for the entirety of the procedure.
The spool and pocket are then attached to the patient temporarily during the procedure using a single-use plastic band threaded through a 3D printed plastic ring tied on the end of a fishing line. We used a plastic ring as opposed to metal because metal touching the skin of a patient can interfere with surgical equipment and pacemakers.
The holster allows the spool to be held securely during the procedure. The 3D printed holder can be strapped onto the bed or anything else in the OR. This ensures the spool can stay out of the way in a secure, designated location that nurses can later access.
All in all, our final design is 10 inches in length, 2.5 inches wide, and weighs 66 grams, not including the holder. First, the nurse or doctor cuts the band off along the designated line. Next, they would fold the band into thirds along the other lines. This ensures that both the barcode and patient information remain accessible while in the pouch. Next, they would place the folded band into the pouch and seal it, securing the band for the duration of the procedure. Next, they would attach the device to the patient using a single-use disposable wristband. This would be cut off and disposed of at the end of the procedure. Now that the device is attached to the patient, the doctor can place it in the accompanying holder. Now, doctors and nurses can easily and quickly access patients' information during surgery, even though the patient's arms are inaccessible. Finally, at the end of the procedure, the patient's identification wristband would be removed from the pouch and reattached to the patient using Team Hospital Tag A's solution.